You ready?
Yes, I am.
Hi, my name is Nicola Prozova and I'm your trainer today, and I'm happy you came. So if you could tell me a little bit about yourself first, and then we will go through my presentation and some ground rules and things.
I'm Victoria. I work at TCS Home Care as Deputy Manager, and we cover the Fenland area.
So today is training about a little bit of a refresher about 6 rights of medication administration and a little bit about the label. So if you wouldn't mind to sign the please attendance sheet. Thank you. So I would like to speak a little bit about housekeeping and ground rules as you know. So firstly, fire safety. So of course we have a door on the right which you will need to, if you hear a drill then you should come and take the first exit, which is here, and then we have quite a few down the hallway. So follow the green fire exit. Today is not a fire drill, it's every Tuesday. So if you hear one today, please do take fire escapes. Toilets, again, if you come out of the hall, you can see few toilets on the right side, so more than welcome to use them. Smoking is not permitted here on my training. So please, if you need a smoke break or anything, we will have those during our sessions. But that will be outside of the building in the car park. Any breaks, because we have only 15 minutes, we won't need any break. But if you do feel you need some, please do let me know. Please, if you could keep your mobile phones away for these 15 minutes, but obviously if you have any emergency or anything, do please let me know and you can pick it up. Please, let's be respectful to each other at the trainings. Everyone has different opinion and different rights, so do, if you have any questions, anything, please do feel free to ask. Do you have any other questions around the rules or anything? So next thing is the aims and objectives. So the aims of the session today is to understand of 6 rights and the label at the TCS Home Care. So we'll look on some examples of the labels and our 6 rights. Hopefully, when we finish this session, you will have a good knowledge of your 6 rights and the label. So can you talk me a little bit about what you have done, or what is your understanding around the 6 rights and medication label? Do you have any understanding?
You need to check all the rights before administering medication, like the right dosage, the right person.
Yeah, so you are correct. So there is 6 rights of administration of medication, as you can see. So it's the right person, the right dose, the right medication, the right time, the right route, and the right to refuse. It is very important to remember those 6 rights, because by Cambridgeshire County Council, they are very hot on those 6 rights, because they say if you follow all your 6 rights, you cannot make mistake in medication of administration. So if you look on each, if you take your box and if you look, there is obviously the right person. So can you see right person on the box?
Yeah.
So that will give you the name. So you always have to make sure this match with obviously your MAR chart and your 6 rights. Then is the right dose. So that will be normally up here, your right dose.
Yeah.
where you can see how much the client should have. Right medication, which is the right name of that, and right route, so it will tell you which way it will go. So it can be by mouth, can be topical, which would be creams, and that will be out there training to explain more the routes, how you administer medication. The right time, it will tell you how often the client should have it, so morning, lunch, tea, depending on the type of medication. And the right to refuse. Each client has the right to refuse any medication, because of course they don't need to take it if they feel. So that's about the right medication.
So what do we need to do if somebody refuses medication?
So if our client do refuse medication, what would you need to do? Of course, you would explain it if the medication is important. For example, if it's paracetamol, if they miss it one, their pain might increase. But if it was like a metformin for their diabetes, then you would have to explain this is for your diabetes. It may not make you feel well, your sugars might go high. If they still refuse, then you would have to notify the office, let them know, and then inform. If this would be repeatedly, we would have to inform the doctors. But if it's one off, then maybe sometimes they have a bad day or they don't feel like it.
Yeah.
So we would ask them for the reason and record everything, because recording is very important.
Yeah.
If you do make any mistakes of those rights, you do have to make sure you obviously let us know, because then if you administer the wrong dose, we would have to inform the doctors and make sure everything is the right way. The next one is a pharmacy label and what to look for. So we went a little bit through it already, where always you have to make sure there is, of course, how much is in the box, the name, dosage, how often. Then they usually give you instructions. You always have to make sure there is actually pharmacy, because it needs to be double checked. There should be always 2 signatures. Now a lot of it is printed, so you will get these codes to make sure, and QR code where they'll be double checked. So there are the labels. Of course, if the labels are expired, you can't administer them, and they do have a life expectancy, only maybe months normally, so we should not be administering medication if it's expired, because it could harm the client. So that's about label and 6 rights. Sounds quite okay, or do you have any questions?
What documents need to be filled in?
So you will have your MAR chart, where you will tick when you administer. You will put your signature on there on the time you administer on your app, or on the app you just tick administered, and it will become green. If they refuse, it will become red.
Okay.
So the next part is to play a little bit of role. So with the 6 rights, I will give you your useful information, so it helps you a little bit with this play role. And what we will do is, if I give you those 2 boxes, and I am your client, and if you just sort of check the 6 rights, if my name is correct, my name will be Michael Crick. So if you ask me those questions, and then we can go through and see if you can administer my medication, or if there is any mistakes.
Okay. So first I need to check your name. So what is your name?
Michael Crick.
Brilliant. So that's correct. And on the MAR chart, I'll check what medication it is and check that it's correct on the packaging. So
Yeah.
that's the next right medication. The right dosage, so that again will be on the MAR chart, and it says on the packet 15 milligrams, so that will be correct on the MAR chart. The right route, it says here swallow medicine whole, so I know that it's oral.
Mm-hmm.
And the right time, I would check to see what time the last dose was given, to make sure there's enough time between visits, and then the right documentation, so that would be filling in the email, checking the care plan, the risk assessment, to make sure it's all correct on there.
Yeah, no, well done. That was really good. Very well done. And do you want to quickly try the other one to see if there is any mistakes on that one?
Yeah, so again, I'll check your name. So
Yes, so my name is Michael Crick, so is there any mistake?
that's not the correct name.
Yes, so what would you do if that wasn't my medication?
That would go back to where it had come from, and then I would go and check the medication to see if there was the same medication, somebody in the same house could be using the same medication, so I'd check for your one.
Amazing. No, well done. Very good job. So let's just quickly a little bit recap. And then if you are happy, I will give you a quick quiz how obviously you learn and what have, learn a little bit. Hopefully you learn a little bit. So we, obviously 6 rights is very important. So why is 6 rights really important to know?
To make sure you get the right medication for the right person, to make sure it's documented so everyone knows that that medication's been given.
Yeah, exactly. And of course it can also prevent any death or anything, because if we administer wrong medication we could really harm somebody.
Mm-hmm.
Label, of course, the label is matched with our 6 rights. We always have to make sure the labels match with the 6 rights, so we have to follow that. Well done. If I give you the quiz, I'm here if you need help.
Okay.
It's not an exam, it's just a little bit of knowing how your knowledge is and how things went. So this question is it yes, is it true, or is it false? Is water one of the rights?
No.
Yes, that's correct.
So the right medication would be one of
Yes.
the rights. 3 examples of what's on the label.
Yeah.
So that would be the patient's name,
Yeah.
the pharmacy it's from,
Yeah.
and the medication name and dosage.
Mm-hmm. Well done. You did really well. So it seems like your knowledge is actually really good. So I am very happy how the session went, but I would appreciate it if you could give me feedback. What could I improve in my lesson and maybe involve more?
I think maybe more questions on the quiz, a bit more in-depth questions.
Yeah, no, I will take that definitely. I never want to overwhelm my learners, but I'm more than happy to put more questions to see your knowledge. Anything else would you recommend?
No, I don't think so. Maybe more examples of different medications, so you can see them on different types of things.
Yeah, no, that's again very valued feedback. Thank you so much for coming today. Much appreciated. Hope you enjoy my training and I hope I see you soon.
Thank you. The training was very good.
Thank you.